Emma. My name's Becky. I work on the floor. If you want, I can go take you out there and show you what it looks like.
Sure. Hey guys, it's Emma and welcome back to the Your Health Matters series, and today we are meeting with Becci Ernest in the acute care unit here at SRMC to see what an overnight stay might look like here. If you have a procedure done at SRMC or might just need a little extra care, and make sure you're in good hands overnight to get prepared for discharge to go home. Let's see what it's all about. All right, Becky, do you mind, now that we are in a room away from patients, if we take off our masks so we can just have a little conversation about the bedrooms?
Yeah, so what can I help you with today?
Okay, so first question is we are currently in a room here at the hospital, which is typically where patients go if they have to stay overnight, correct?
Yes, this is an inpatient room. You've got a private room here. You won't ever have a roommate. You've got a bed, your own private bathroom also.
Okay, and then why might you have to stay overnight at a hospital?
So typically for people your age would be young women having babies, so then you're here for labor and delivery and postpartum. But other reasons that we might see someone your age would be maybe you need your appendix taken out surgically, maybe a gallbladder, if you have some kind of infection like pneumonia or something that would require IV antibiotics to stay overnight.
Oh, okay. So it's not very often that you might see someone like me.
No,
here
we
at
don't
the
see
hospital.
people your age here overnight very often.
Okay, and what would a stay look like when you're here at SRMC?
So I can kind of give it to you from a nurse's schedule, I guess. So first thing in the morning, as a patient, the first person you would probably see would be the nurse's aide. They would come in and get your vital signs right away, see if you need any more water, help you to the bathroom if you need. And then after that, your nurse would come in, do an assessment on you, give you any medications that you might need. And then you'd have breakfast. We give you breakfast, lunch, and dinner here from the cafeteria. It's a hot meal. You can put in your preference on what you want. And then we've got snacks throughout the day if you want that as well. And then usually between 9 and 10 is when the hospitalist will come and round on you. So you'll get to see the doctor who's managing your care. You know, they will have reviewed any lab work that you might have had done early that morning, just see how you're feeling, how you're coming along. And then at that point you would discuss with the doctor whether it looks like you need to stay another day or if you would be home and ready for discharge that day.
Okay, and what would discharge look like?
So discharge, it takes a few different people kind of working from different angles to get your discharge. Once the doctor is done visiting with you, doctor puts in the order for discharge, and then your nurse is the one who gets that ball rolling with paperwork. We contact pharmacy to see if they need to come and visit with you about any new prescriptions you might have ordered. And then once all the paperwork is in order, your nurse will come and just review what we've done for you in the hospital, any changes we've made to your diet, changes to your medication routine. If you have any new prescriptions to pick up, they'll be sent to a pharmacy and we'll talk to you about that, where you can go for those. And then we'll just walk you out of the building and make sure that everything is taken care of and that you're prepared to go home and manage whatever it is that you were here for.
And Becky, when it comes to trying to find resources for information, who would I be trying to reach out to about my health?
So first of all, I would start with your primary care provider, and they always have clinic nurses available to help answer phone calls and direct you in the right path. And then your provider, based on what types of questions or what types of diagnoses or things that you're dealing with, they can direct you to, the best website reference. A lot of times they will give you printed information at a clinic appointment. But I just want to say that, TikTok and Google is not always the best resource for that. There's a lot of misinformation out there, things that can be confusing if it's coming from a slanted direction. So always start with a recommendation from your primary care provider. And then if you're going to do your own, online internet searching, just make sure it's from a reputable source and based on evidence-based research.
So lastly, I guess all I have is, what tips would you personally have for teens and young adults who might be expecting or unexpectedly having to stay overnight here at SRMC?
Yeah, so some people might think that staying in a hospital can kind of be a scary thing. You know, we're here every day, we do this all the time. I wouldn't want anyone to feel overwhelmed or scared. Biggest thing is just to know that there's always someone here to help you. That's our goal, is to help you get better, to be there for you, answer your questions. No question is a stupid question, so if you're curious or uneasy about anything, just ask us. We're happy to help you. Another thing that might prepare someone to come and stay is just to know that you're not here alone, you know, as far as the people who are important to you either. We do allow visitors in the hospital throughout the day, so you know, family members, friends, they can come and sit in the room with you and do all of that. And then, you know, we've got a great team here. So between nurses aide, nurses, charge nurse, you know, our people who work in the kitchen, there's people in and out of here ready and willing to help. So.
Alrighty. Well, thank you so much, Becky, for talking with me today to help reassure those who might have not had an overnight stay in any hospital, but let alone here at SRMC, and make them feel a little bit more comfortable for when they do have to.
Yeah, no problem.
For more information, visit sydneyrmc.com/yourhealthmatters or call us at 308-254-5825.